Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. April is Testicular Cancer Awareness Month. Nearly 10,000 American males, the majority of them under the age of 50, are diagnosed with testicular cancer each year. Globally, testicular cancer rates continue to climb, but the good news is mortality rates are declining. So what's causing this, and what can be done about it? How can you prevent testicular cancer? We'll answer those questions and more as we're talking with Dr. Ali Hajiran, Chief of Urologic Oncology at the WVU Cancer Institute. Welcome, Dr. Hajiran, to Live Healthy West Virginia.
Well, thanks, Mary. Thanks for having me here. It's an honor to be back and excited to talk today about this important topic.
Well, it's great to have you here. So let's start with the basics. What is testicular cancer?
Sure, that's a great question. So there are special types of cells in the testicles for men called germ cells. That's where sperm is made from. And in certain situations, those cells can start to divide abnormally and grow at an uncontrolled rate. In that case, you can develop a tumor in the testicle, and that, if it continues to grow, has a risk of spreading to other places in the body where it could start to pose a threat to a man's life. It's the most common type of cancer in men between the ages of 15 and 45. It's estimated this year in the United States, approximately 9,000 to 10,000 new cases will be found, and the most common age of diagnosis is around age 33. So younger men are being affected. So that's why it's an important topic.
Yeah, when I was researching this, I was surprised that it was, more common in younger men as opposed to older men.
Yeah, it's unique in that sense because again, this is coming from germ cells in the testicle, and there's not a lot of risk factors that we know or things that you can do to prevent your risk of having it.
What are the key risk factors?
So the key ones that we know about that is if men who are born with what's called an undescended testicle, or a testicle that doesn't descend all the way into at birth, those men we know are at higher risk. Men with a family history are at higher risk, and certain genetic syndromes such as Klinefelter syndrome are at higher risk. But unlike other types of cancer, there are not really, we haven't really identified any lifestyle factors or things that you can do to change your risk. These are kind of things that you're born with that put you at risk.
Oh, okay. So since we can't always predict who will get testicular cancer, what can men do to catch it early?
Sure. So the main thing that we recommend, and that's generally recommended by our testicular cancer awareness groups, is doing a monthly exam. So once a month, men are encouraged to do an exam on to check both testicles for any abnormalities or irregularities or abnormal enlargement of one side. Those are things that we encourage men to check for once a month to catch something like this early.
Just like women do monthly breast exams.
Exactly. Yeah. Same thing. And that's the best way, to catch it early.
Yeah. So how should men perform a testicular self-exam?
So the way that's recommended is either while in the shower or a hot bath. That's the best way. That's when you're the most relaxed and able to get a good assessment. And so we recommend, in the shower once a month to check for anything different or new.
Yeah, like what should they look for?
Really any lumps or bumps or asymmetry in the size, anything new that you haven't noticed before would be something that would tip you off. Or a new pain. That's some men can have pain. A lot of times there is no pain, and so that's important to know as well.
Okay, so there could be pain, there could not be pain.
Sure.
Okay. Are there any official screening guidelines for this kind of cancer?
That's a great question. So unlike other cancers such as like breast cancer and colorectal cancer, testicular cancer isn't common enough that we have a typical screening test like blood test or imaging studies that we do for all men. So that's why the self-exam is such an important thing, because it really puts it in the hands of the patient. They have to participate in the early diagnosis, and that's what the self-examination.
Okay. Well, if a patient does notice a lump or has some kind of unusual symptom, what is the typical diagnosis process?
Sure. So if you ever notice a lump or bump or something abnormal, we recommend to let your primary care physician know, or even come to a urologist, straightforward. The test that we do to check for that is what's called a scrotal ultrasound, which is a really simple, easy test to do where we use an ultrasound probe to look at each testicle. It's a fast procedure, and it has a really high sensitivity and specificity for catching tumors really early. And so we really encourage men with any concern to have the test done, because it's a quick and easy test, and it can tell us a lot of information.
Okay, good to know. What role do tumor markers play in diagnosis? What is a tumor marker?
Yeah, so a tumor marker is we have a blood test that we can do to check for certain types of testicular cancer. Will make your body produce levels of tumor markers, or which are blood tests that we can check to see how much testicular cancer may be there. And so, although not a screening test, but when you have an abnormality on your scrotal ultrasound, a lot of times we'll get these blood tests to check to see if you have a high elevation of these numbers. That could be a sign to us that you may have testicular cancer in other places in your body, and tips us off to look for them. It also is a good way for us to check to see how well we're treating it, because if you have an elevation and we treat your cancer, those markers should go down to 0. And so then we can follow them going forward, and they tip us off if your cancer's coming back.
Oh, wow. Okay. So how do you treat this? This kind of cancer?
Sure. So there's essentially three stages of testicular cancer. There's stage 1, where it's just within the testicle. Stage 2 is when it is spread to lymph nodes that are in the abdomen. Stage 3 is when it's spread to other places, such as the bone and lungs, other places in the body. The good news is that even if you're diagnosed with an advanced stage, 95% of men have curable testicular cancer, even at advanced stages. Yes. And so it's really responsive to chemotherapy that may be involved with a combination with radiation or surgery as well. So we have good survival rates. It's very responsive to our treatments. And so for stage 1, it would maybe all you need is to have surgical removal of the testicle. For stage 2, that's when you might need chemotherapy and a bigger surgery to remove the lymph nodes. And stage 3, again, would be chemotherapy either with surgery or radiation.
Okay, so it sounds like the chemotherapy and radiation are for the later stages.
Yes, and the surgical removal is what most men, if it's caught early, that might be all that you need in close follow-up, so we can catch it if it came back in another place in your body. Okay,
so what would you say is the survival rate for testicular cancer?
So very good in most men, as long as the men that get in trouble are men that may not follow up according to the recommendations. And so it is a group of men who sometimes it's hard to track down. We're younger men in their 20s and 30s, and may feel good and may feel like they don't have anything wrong, but it's important that you hear we have specific guidelines based on the type of testicular cancer they have to follow up. But most men will live a full normal life if they follow the treatment recommendations. Again, 95% overall, regardless of what stage of testicular cancer you have.
If you have to have one of your testicles removed, how does that affect fertility?
That's a good question too. So for fertility, what we tell men, typically men with one testicle will eventually have the same fertility rate as a man with 2 testicles. Overall, we do offer sperm banking, encourage men to get sperm banking as a backup plan in case they're having difficulty with fertility. And that's especially important in men that have to get chemotherapy, because if you have chemotherapy and have the loss of one testicle, the fertility rates are known to drop more significantly in that setting. But just surgery to remove one testicle, most men will still have the ability to father children as if they had 2 testicles.
Well, that's good to know too. How does early detection impact treatment options and prognosis?
That's a great question. So for For early detection, again, if we're catching your testicular cancer very, very early in the stage 1, then we're able to only do the surgery to remove the testicle, and you may not need any additional treatment. If men are showing up once they're feeling more symptoms such as abdominal pain, back pain, or shortness of breath, that's usually a sign that it has spread to other organs, and then your treatment might be more involved and need different steps, including chemotherapy and more things after that.
So earlier is better.
Earlier is better. It should be the earlier we treat it, the better chance you have of only needing one modality to treat it.
So they should be keeping up with the monthly self-exams, right?
Monthly self-exams and coming in at the first sign that something might be abnormal.
Okay. What advice do you have for men regarding testicular cancer awareness and prevention?
So I think it's really important to make it more normal to know about that it's out there, especially for younger men, and to encourage these self-examinations. A lot of men are it's a sensitive area. They tend to come in later, so it's really important if you're concerned at all to not be ashamed and to let your doctor know, because we're here to help and we want to catch things early if there's something wrong. And so that's the main thing that we want to drive home, is to not wait until things get really bad to try to come if you notice something's wrong. Especially if you have one of the risk factors that we know of, to come in and get checked out by our team.
And I know it's a small percentage, but men over 50 can get testicular cancer too, right?
They can. We do see some men, every year, outside of that range that we talked about, the 15 to 45. It's more rare in those settings, but we still will see it. So men in that age group are still encouraged to come and see us if they have any concerns.
What should parents and family members do to help raise awareness about testicular health?
I think, again, just spreading the word about doing the self-exams, about that disease type exists. A lot of people don't even think about that it happens, and so that's why we're glad that we have April as Testicular Cancer Awareness Month, just to raise awareness to men to start checking for it and maybe catch a few cases earlier than they would have had otherwise.
Okay, so can you talk a little bit about the expertise of the team at the WVU Medicine Urology Department and the WVU Cancer Institute, because that kind of overlaps in what you're doing here, right?
Certainly, yeah. Since we talked about many cases of testicular cancer are going to need what's called multimodal therapy, or that means the expertise of a surgeon, a radiologist, a radiation oncologist, a medical oncologist. And so it's important to come to a place like West Virginia University where we have groups that work together. We meet every Wednesday to review cases like this in the big group of all the different specialties, so we can figure out which treatment is best for each patient. And that's particularly important for testicular cancer, because we want to review the imaging together, or review the lab work together, and make sure that we're making the right diagnosis and the right plan for each patient. So I think that that's why it's important to come to a tertiary care center with expertise in this cancer type.
And I think it's important to emphasize you don't have to leave the state to get excellent care.
Yeah, absolutely not. Yeah, this is what we did our training in. This is what we're equipped to deal with, and so we treat many men here and have great outcomes in men that have testicular cancer, and we're happy to do the treatment here at home, so they don't have to travel outside of the state.
As I say, it's right here in our front yard, right?
Yeah.
Okay, so before we go, I always like to ask, what's the most important thing you want our viewers and listeners to know about testicular cancer? So
the most important thing is that, again, common in young men, we expect you to do well if you adhere to the treatment guidelines. And we want you to come see us early if you have any concerns, so we can see what's wrong and get you on the right track. And we'd rather do the test and find no evidence of a problem than find out too late. So that's the main thing we want to encourage men to know about the disease.
Those self-exams.
Self-exam's important, yep.
Yep. All right. Well, thank you so much for sharing this information. I think we helped a lot of people today, and we're spreading the words here. So.
Well, thank you again for having me. It was great to be here and talk about this topic.
Great to have you. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about testicular cancer and other urologic conditions, visit wvumedicine.org/urology. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or the new Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Hajiran and everyone at WVU Medicine, thanks for joining us.